Today on the Health Insider, we're joined by Dr. Howard Chertkow. Dr. Chertkow is one of Canada's leading neurologists, scientific director of Baycrest Kimel Center for Brain and Health Wellness. Welcome, Dr. Chertkow.
Thank you very much.
Thank you for being here. This topic today is near and dear to my heart. My mother suffers from Alzheimer's and is in an assisted living facility. And of course, this subject is of great interest because of my mother, and also because, I know that genetically I'm also now at risk, and we'll get to that. But let's start with the basics. What do we now understand as the main causes of Alzheimer's and other forms of dementia?
Well, that's sounds like a simple question, but it's actually a very complicated question because dementia, well, what is dementia? Dementia is changes in thinking and memory and your higher brain processes of handling your life and judging and planning your life, changes that usually occur as people get older, but we now understand are not normal in the brain. Now, these changes, it's like a family of illnesses. It's not one disease. Alzheimer's disease is the leading cause of dementia. Dementia is like this clinical umbrella term. And there are other different diseases defined by looking in the brain, looking at the chemistry, looking under the microscope. So it's a family of illnesses. So what causes dementia? Well, the simple answer is there's a set of risk factors, and the greatest risk factor is aging. 10,000 years ago, people lived to be 38, and now they're living to be 78 on average. And our bodies were not really well designed to get this old. That's the basic genetic fact. And so things start to break down. Your eyes get cataracts, your hearing gets lost, your bones start to degenerate, and the brain starts to lose its cells. But more than that, we see abnormal proteins in the brain that don't occur in young people. And these proteins are associated with loss of memory. And now, are the proteins the cause? Are they a side effect? Is it loss of the brain cells? Is it a combination of things and problems with blood flow? There may be more than one mechanism resulting in dementia, and even something which is sort of coherent, like Alzheimer's disease, which is a diagnosis based on seeing certain brain changes, certain proteins, may have subgroups where one group of people it's more to do with oxidative stress, one group where it has to do with amyloid being laid down, and another protein tau. So it may not be that it may look like one thing, but actually multiple causes or multiple subgroups. The basic answer is that in Alzheimer's disease, it's about half genetic and half environmental. So we are born with genes we inherit from our parents. There are some genes that have no effect on the brain. There are other genes that make your brain more resistant to sort of the trials and tribulations of lifelong aging. And there are other genes that make you more susceptible to sort of these bad effects on aging. And these are called risk genes. Very rarely there are genes that we can say this gene causes Alzheimer's disease. Everyone who's got this gene will get Alzheimer's disease. This is maybe 1 out of 20 cases have. We call this familial Alzheimer's disease. Families where half or even more of the children develop Alzheimer's disease. But in most cases, the genes, the things you're given by your parents, are just one part of the picture. And this makes it very complicated because we see people in our memory clinic. I spend a lot of time in the memory clinic seeing patients. We see people who develop Alzheimer's disease and their family members say, no one's ever had this in the family. Why is my father getting this? No one's ever had this. And we have to think it's something in the environment. We can come back to what those things are in a minute. And there are other families where they say, well, everyone seems, or most people in the family get Alzheimer's or dementia when they get over 80, and this is just expected. So there's genes. Some families, they're bad genes. Some cases, it seems to be much more environmental.
And yet, I think it's you that has been quoted as saying that the risk for Alzheimer's can actually be reduced by 50%. Explain that amidst this myriad of
I,
possibilities.
well, it looks like studies that have been done on populations, you can study individual people and you can study populations. And when you look at the population, you can do statistics to say what percent of Alzheimer's disease or dementia cases, actually usually dementia, what percent are attributable to things like smoking or things like high blood pressure or things like obesity. And this is a field called epidemiology. They look at risk factors in a population. And it turns out that each of there are many things which have to do with bad blood flow. Things that are bad for your heart are also bad for your brain. So a chunk of the risk is related to high blood pressure. So high blood pressure, smoking, high cholesterol, diabetes, obesity, all these things that are bad for your heart are also bad for your brain. And that underlies a truth we've learned even about Alzheimer's disease is that blood flow and things that impair blood flow, cause hardening of the arteries, things that cause strokes and heart attacks also cause dementia. And so, and these are all things that we know how to treat. We know how to treat blood pressure, although only about 1 out of 4 people with high blood pressure over age 65 are being adequately treated. So, in a way, the easiest chunk of the problem to deal with are related to what we already know, high blood pressure, diabetes, and so on. But it also appears that inactivity, lack of exercise, poor diet, things in your lifestyle or mine can be mitigated, and those also contribute to the risk of getting dementia. So if you add up all these things that could be lifestyle changes could affect, turns out you could probably reduce in theory, and I emphasize in theory, if you corrected all these, you could probably reduce about half the cases of dementia. And it's important to stress that this is theoretical because, look, we've known how to treat high blood pressure for 50 years, and yet there shouldn't be anyone wandering around with high blood pressure. But you may have noticed in Canada, not everyone has a doctor. Not everyone is prescribed the right medications. Not everyone takes their medication. We all know that exercise is good. What percentage of people in the population are doing exercise? So there's a gap between what we could be doing to mitigate or prevent dementia and bad aging of the brain. It's a gap between what we know could be done and what is being done. So part of our role as physicians and as a population and in public health is to try to close that gap, as we've done in smoking. The number of Canadians smoking now is far less than 50 years ago. So it's a public health intervention. And then there are other things that people aren't aware of. For example, good sleep. If you're people who sleep less than 6 hours a night, increases your risk of getting dementia and Alzheimer's disease because we now know that there are toxins in everybody's brain which are cleared out during sleep. And my grandmother always said, sleep is important, sleep is magical. Turns out she's right that by sleeping, you're actually treating the toxins in your brain. So everyone should be. I've added an hour to sleep by reading this evidence. I thought, I've got to add an hour to my sleep, and 7 or 8 hours gives you the time to clear out the toxins. People who floss their teeth once a day clear out certain toxic bacteria in the gums. Again, everything your grandmother told you to do, floss your teeth, brush your teeth, look after your mouth. Turns out you're getting rid of toxic bacteria that somehow are increasing the risk of Alzheimer's disease. And we've shown this in Canada, we've shown this in other countries. So there are risk factors in the environment. The leading one, of course, is always exercise. And there are Canada guides that you should be getting 150 minutes a week of vigorous exercise. Not everyone is doing that, and everyone should be, because clearly this is a very robust way to protect your brain. And diet, people are hearing about the Mediterranean diet, the
Right.
Mayan diet, eating less red meat, eating more green vegetables. And it looks like people who follow these diets, it lowers the risk of getting dementia and Alzheimer's disease. So there's a lot that people can do you can't affect your genes, but you can affect your environmental risk factors. I
Right.
suppose the problem is that the list is incomplete. So every year, and this is why we have meetings, every year research is finding new risk factors that we didn't know about. For example, this year there was research in New Mexico that found that people dying with Alzheimer's disease had 10 times the level of microplastics in their body and their
Wow.
brain as other people. Now, is that causing their Alzheimer's or contributing to it? We don't even know, but it's sort of a shocking discovery. And we're finding it now because they didn't have the techniques to find these nanoplastics 20 years ago. So it's becoming more evident that things, pollutants and plastics, every time you heat something up in the microwave in a plastic dish, microplastics get released into your food.
Right. Bottles of water, I guess, all of
So
that.
we're going to have to rethink our exposure to plastics. Pollution in Mexico City, where it's quite a polluted city, they're finding the changes of Alzheimer's disease in the brains of people in their 30s and 40s who die in traffic accidents. Their brains are looked at, and they look like the brains of 80-year-olds with tau protein and amyloid protein. So there's lots of evidence accumulating that if you live close to a major highway, your risk is increased. If you live in an area in England which has more trees and more parks, your risk of Alzheimer's goes down. So pollution, diet, exercise, all these things that you can do in your life, or can try to change. There are many things people can do to lower their risk.
So interesting. So that's, yeah, the myriad of environmental, diet, exercise, et cetera. And then there's the familial, as you said, the Alzheimer's gene. And I can't tell you how many people have told me, are you going to get tested for that APO4 gene? And then I hear from somebody that, well, what are you going to do with that knowledge once you have it? So what are your thoughts about that?
Right.
And maybe you can just explain what this gene is.
Exactly. So genes you inherit, as I've said, and one of the genes, which is maybe the strongest risk factor, is called apolipoprotein E type 4. So you get this, you get a one contributor from your mother, one from your father. So people have an E4 or an E3 or an E2. If you have an E2 from each parent, you're actually protected to some degree from getting Alzheimer's. If you get an E4 from each parent, it increases your risk. And it has something to do with what this protein does is carry fats in the bloodstream and probably plays a role in the synapses and communication in the brain. But somehow this E4 gene, if you have it, it increases your risk. Now, what's important to say, this is not the only gene, and we don't know enough. We need is sort of an app where people put in their genes and then they put in how much they exercise and what their diet is and how many microplastics they have in their body and how much pollution they're exposed to. And then you have sort of an algorithm. We don't know enough to do that yet, but we now know it's not just one gene for Alzheimer's. There are 84 risk genes, and each can contribute a little bit of risk. So what we can do in the research lab, we can take a sample of blood, a very small sample, and we can run, the technology now is astonishing. We can run all of these genes and we can print out we call it a polygenic hazard score for each individual and tell them, are they at high risk genetically or medium risk? We have a dementia prevention center at Baycrest called the Kimel Family Center for Brain Health. One of the things we're doing for our clients is we're doing this polygenic hazard score. Turns out about 10%, I mean, you have to realize that most of the people entering the center have some reason to worry about having Alzheimer's or dementia. It's in their family,
Early,
someone
early
has
signs, or
yeah. And
Yeah.
only about 10% of the people who come in our door score as having a high genetic risk because you might have the ApoE4, but you might have other genes that protect you. So it's a balance in all of these 84 genes. So um, what does the ApoE4 gene do? Well, it probably makes your brain more susceptible to damage from brain trauma or other sort of brain insults have to do with what's called oxidative stress. You've probably heard about free radicals,
Mhm.
and people eat, vitamin C and orange juice to protect you from free radicals in the body because vitamin C protects the body from oxidative stress, which we're getting from the environment. So ApoE4 makes you less able to tolerate oxidative stress. So if you want to hear a piece of advice, if you have two copies of an ApoE4 gene, you probably shouldn't play football because people who play football, they're getting knocked on the head and they're getting trauma to their brain. Their brain is probably less able to withstand injuries than someone else. They probably shouldn't play contact sports. So we do, however, know that there are people who have ApoE4 gene and even one or two copies, and they live up to age 95. They don't have Alzheimer's disease. And
Interesting.
we know that there are people without the E4 gene who do get Alzheimer's.
Tell
So
me something. It's something I've often wondered. What is the difference between correlative and, when something exists in an Alzheimer's patient, how do you know that it isn't just a correlation? Those who have Alzheimer's, or a lot of them also have this, as opposed to causal. Where does one end and then the next begin?
yeah, that's a sort of a billion-dollar question because when you see two things that go together, you don't know if one is causing the other or they're both being caused by
By
something
a
else.
third item, yeah.
And that's why the only way to, or the main way to prove causality is you do what's called a randomized trial,
Right. Double
where you
blind.
control, for example, you give a drug or
Yeah.
um, and we see a lot of associations. For example, we see association, people with Alzheimer's disease have amyloid plaque, this amyloid protein in their brain when we look in the brain. So is that the cause of the Alzheimer's disease, or is that a product of the brain trying to fight against Alzheimer's
Right.
disease?
Right.
And people of scientists of goodwill have been arguing about this for 30 or 40 years, and the question still isn't answered. It was hoped that, and certainly it is a billion-dollar question because the pharmaceutical industry has spent billions of dollars developing anti-amyloid drugs better and better in the past 20 years. Antibodies and immune factors that you inject them in someone's vein, they hook onto the amyloid and get rid of it from the brain. The hope was that this would stop Alzheimer's disease or reverse it or return people to normal if amyloid was indeed the cause. Well, even with the best anti-amyloid drugs, and two have been released in the United States and are available to people with Alzheimer's, what they do, they don't reverse the disease or even stop it. They slow the progression by about 25 to 30%. So what does that prove? Well, it's not nothing. And this, for some patients, that is meaningful slowing of the disease, but it's not the home run that we'd hoped for. We
Right.
get rid of the bad protein and people will be cured.
Okay, interesting, very interesting. One of the things that you haven't made mention of, and I'm wondering what your opinion is. A while back there was a movie on Netflix. I think it was called not Alive Again, or not sure, but it talked about the impact of music on patients with dementia and how these patients came alive. And sure enough, I saw this movie. I recorded all of this music from my mother's childhood. I played it for her, and I found that when I first saw her, she's almost in a catatonic state. And playing the music, it slowly brought her to a much more conscious, interactive state where she was laughing and singing along. And I was able to engage with her, whereas I couldn't otherwise. It wasn't sustaining, but for those moments that I was with her, it really made a difference for me anyway, and seemingly for her. What do we know about music and dementia?
Well, music is a fascinating area because music engages different circuits than just talking and just asking questions, and it connects with emotions. There are Parkinson's patients with severe Parkinson's who can barely move, and you put on a song they like, they'll get up and dance, and somehow music can bypass. Maybe because of the emotional impact, or maybe because it's old memories, but sometimes you see remarkable. Um, we have people who can't talk, and you put on a song and they'll sing to the song. So it's certainly always worth using art and music to try and connect with people with any form of dementia. And that's a great story from your mother. We do see that. It doesn't, as you say, um, it's not curing the
Sustaining.
disease, but
Yeah.
but people have a lot of reserve. You're tapping into their cognitive reserve and residual memories and residual brain function in a unique way. And this is why, for example, if you have a relative with severe Alzheimer's disease, the thing to do is not try and talk about the weather or current politics. You go with books of pictures from long ago, because the old memories are much more likely to be remaining, and people will get excited and talk about things from their childhood and years ago, even
Yes.
when they can't tell you anything they did earlier in the day. So
Right.
you always got to tap into residual abilities.
Excellent. Okay. So where's the hope? What excites you the most these days in terms of
Sure.
research?
Well, I think that this is the decade we're really going to make advances in prevention. For a number of reasons, we now know how to find people in the very earliest stages who have changes in their brain on imaging and blood biomarkers, even when they have very mild memory loss or even no memory loss. And so we know who's at risk. We can find these people, and we now know, lifestyle changes, education, but also there are probably about 24 medications which can probably slow the progression. And I believe if we can figure out a combination of medications which is feasible, not not expensive enough to break the bank, and non-toxic, find people at risk, get them the medications, get them to do the lifestyle interventions. I believe we could probably prevent more than half of the cases of dementia. There's just um, so many possible intriguing drugs. Some are currently in clinical trials. Some I'm sure you've heard about. Even they're looking at the key trials on Ozempic and things like Viagra and Cialis and other PD-5 inhibitors. These are medications that are available for other reasons. And it appears that people who use these medications have a lower risk, about 50% lower risk of getting Alzheimer's disease. So there are medications already available that probably make a difference. The thing is toxicity and price and how they work together. So the trials have to be done properly, but there are things out there. Some are being tried and some are just coming down the pipe that I think are really going to make a difference for prevention. As far as treating people who have early Alzheimer's, I think that's coming, but the problem is we're up till now we've been treating it as a one size fits all, an anti-amyloid drug for everybody.
Correct.
Well, it worked probably worked in some people and not others. So we have to move to what's called precision medicine, where we figure out for each individual what is the mechanism causing their brain injury, and then that's what we target. So we have to start viewing Alzheimer's disease and dementia as multiple subgroups and then target the therapy for that individual
Specific.
person. So I think those are the two advances and approaches that excite me. I think we're going to see some serious prevention and treatment developments over the next few years. And I think I tell the young neurologists and young geriatricians, you're lucky because I've had in my career for, how many years waiting for the effective treatments for dementia. Alzheimer's remains the only one out of the top 10 diseases of aging, the only one for which we don't really have an effective treatment to stop it. So I think the next generation of doctors are going to
I
be
see it.
the ones who are able to give those medications, and the people developing memory loss now may be the ones that benefit. So I think there's very hopeful. Medicine has a lot to offer in the coming years for dementia. I think we're going to have much greater impact in the future than we've had up till now.
It's very encouraging, and on that note, I think we'll wrap. So, thank you very much. It was fascinating. I learned a lot, and really appreciate it. And I wish you and your colleagues the best of luck and success, and discovering a cure for Alzheimer's. Thank you so much, Dr. Chertkow, for joining us.
You're very welcome. Happy to be here. Thanks for having me.
Thank you. Bye for now.
Mm.